to make sure that our teams could properly social distance from one another, the first thing we tried to do was get as many people as we could out of the building quickly. When we were asked to send people home, the vast majority of our licensing department did not have laptops, and some of our administrative assistants didn't have them as well. And within a matter of days, the IT department had outfitted everyone with a laptop with VPN access.
Aetna's service operations team moved more than 4,500 Aetna employees in a matter of 2 weeks with no stoppage in service for our members and plan sponsors.
We do need to make sure we are supporting our members, plan sponsors, and of course our colleagues that are on the front line.
The janitorial work and the degree and the processes for cleaning have been increased tremendously for any site.
We do have hand sanitizer throughout the site, Clorox wipes, and for large scale offices, we do have security on site that will check someone in so that we know who was in the building, when they entered, when they exited.
There's a different pace. There has to be different processes, and we have to focus on performance in a more rigorous and supportive way. And to do that, you have to use different tools and different degrees.
From utilizing our phones to send text messages or conduct voice meetings along with actual video chat, our laptops, PCs, as well as things such as Microsoft Teams, Skype, they've all been great tools. We created the National Accounts Plan Sponsor Services Engagement team page. It gives them an area in which they can communicate and chat with employees and their colleagues from all across the company. This is important because focusing on COVID-19 all the time, all day long, can be mentally exhausting.
We've tried to do a couple of different things. The folks who were in the office were able to gather socially distant. They were each sat at a different table wearing their favorite sports jerseys. We did one conference call last week while everyone was out for a walk. It was a nice way to spend a half an hour and make sure that people were getting a break and getting outside.
We have to nurture familiarity and connections in a way that we didn't have to do before in a very dedicated fashion.
Flexibility and empathy are so important right now because we're working in incredibly stressful conditions. We are part of the healthcare delivery system, and we're critical to helping patients combat this disease.
We are going to come out of this being a more flexible, collaborative, empathetic organization.
Our purpose of helping people on their path to better health has never been more obvious than during this pandemic.
We are learning from this, and we're going to try to codify what we're learning and keep the best of what this time has taught us so that we can be better on the other side of it.